Susan, will you please tell us about your dog Rocky's vaccine injury and your dog Talia's quick recovery from a rattlesnake bite to her cornea?
Yes, yes. So I have 5 Chihuahuas. All are from rescues or shelters. And one, a year and a half ago, my dog Rocky went in for his rabies booster, which is a vaccination which is required for all dogs, I believe in all 50 states. It's the only one that's required in California. So he had his rabies booster, and about 1 week later, he threw up in the middle of the night, a very weird green vomit in bed. And he always gets up with me and first thing in the morning. He did not get up. And I knew something was wrong. So I took him to the vet right away. And they did blood work, and my vet said, your dog needs a blood transfusion right away, and we can't do that. You need to take him to the 24-hour veterinary care facility, which is about 90 miles away. And he said, it can't wait till tomorrow. So I took him to the pet hospital, and they immediately put him in an oxygen chamber and did some blood work and told me that, yes, he definitely needed at least one transfusion, and that is a risky treatment, but that it was critical. It was life-threatening. And I thought back to, he had his booster the week before, and all of a sudden this happened. And so I asked both my vet and the specialists, I said, could it be, because they're saying, well, it could be. It seemed like his body was destroying its own red blood cells, is what his body was doing. It was an autoimmune response. And I said, well, what he had, could it have been the rabies booster that triggered this autoimmune response? And these are traditional vets. These are not vegan vets. And they both said, yes, it could be. To where my vet, my regular vet, again, not vegan, is going to exempt Rocky from rabies vaccines, which requires him to write a letter to the board that oversees vaccines, because he won't vaccinate Rocky again. So Rocky spent a week in the 24-hour care facility. He required 2 blood transfusions, and plus a pretty heavy dose of steroids to stop the autoimmune response, and some other medications. And he's recovered. He's fully recovered now. He had to get blood work every month for about a year, just to monitor and gradually phase him off of the medications, because you can't do it immediately. He's not on any medication. He's fine. He's healthy. He's great, but it was enough of a scare to me that I won't do any vaccines except the rabies, because that's a legal requirement. And quite frankly, if my dogs bit someone and weren't rabies vaccinated, they could be destroyed. So, but Rocky is fine. He's recovered from that, and that is pretty miraculous. So Talia Rose, 6-pound Chihuahua. I've got rattlesnakes where I live in a rural area. A year ago, we were walking on leash, and a rattlesnake was in the grass and bit her in the cornea, in her eye. The fang went into her cornea. And she's only 6 pounds. So the rattlesnake didn't buzz her. It was thinking, here's a good meal. So, and that could be fatal for an animal that small. Fortunately, it was a weekday morning. I picked her up, carried her, called the vet, said, I'm coming down. She was on the IV getting the anti-venom treatment within 30 minutes of being bitten. The vet was concerned that she could lose her eye. And so once they stabilized her overnight, I had to take her again I had to take her to the eye specialist the next morning. And there were two possibilities, one that she could lose her eye or lose the sight. But what was quite miraculous is that she had a full recovery. She doesn't lose her sight. She just has a scar on her face. I wish she was sitting here, I would pick her up. She has a scar where her tissue died on her face. But I think between her being super healthy, and one thing that I did, in addition to what the veterinarians gave to me, the antibiotics and the eye treatments, I gave her some vitamins, a little bit of vitamin C powder, again, through consulting with Eric Weissman. Now I know I could call Dr. May as well, but through consulting with Eric Weissman, I gave her some vitamin C in a syringe. So when I brought her home the first night after her being on the anti-venom treatment all day, she was unable to, she spent the night there. So I got her the next morning and she couldn't even stand up. Her body was like rigor mortis. She couldn't stand up or sit up. I took her to the eye specialist in that condition, took her back to the vet. They gave her a steroid injection, brought her home, put her in a crate, gave her some of the vitamin C in syringe, and she was up and running the next morning like everything was fine. So yeah, those are my two near-death recent experiences with my dogs. Thanks.
Thank you, Susan.
So I'd like to comment on Susan's story, and I'm sorry about what happened to her dog, and I'm glad that the dog is better now, thank God. There actually is a patient of mine right now who suffered an adverse vaccine reaction, a puppy, upon receiving his 4th distemper parvo vaccine by another veterinarian. He began having some chattering of his teeth, which interestingly is one of the signs that one may observe with the distemper disease itself, but not the full range of symptoms was experienced by this dog. And I have him on a homeopathic remedy. I don't make homeopathic recommendations on a across the board basis. The way homeopathy works, it's very individualized based upon the individual patient and his or her full range of emotional, mental, and physical symptoms. There's not a cookie cutter approach to it, the way in conventional medicine we would prescribe a certain antibiotic or steroid or some other anti-inflammatory or some other medication. It's not a standard approach. So it really depends on the individual patient and the full range of emotional, physical, and mental symptoms that that patient exhibits that will then lead us to picking a remedy for that particular patient. The beauty of homeopathy is that it's very gentle on the body. It can have a really curative effect if the right remedy is selected, because it works on a root level with the patient's vital force. It's not a well understood modality here in the United States because unfortunately that's been squashed by the pharmaceutical industry over time. They've favored surgical and pharmaceutical interventions over homeopathy, which has led to a cascade of problems, the shutdowns of homeopathy schools, the maligning of homeopathy as a medical practice, but it has a lot of applications for humans and non-human animals. It's offered in all sorts of countries around the world, India, Mexico, Germany, many countries that have utilized it for a wide variety of medical conditions successfully. Now, there are times when someone might take a homeopathic remedy and not experience the desired result. And that could be for a number of reasons. It could be that it wasn't well suited for that particular person's situation. It could be that the remedy wasn't taken appropriately. It wasn't monitored. The progress in response to the remedy wasn't monitored, and the follow-up remedies weren't given at the right frequency and potency. So there's a lot that goes into that. What I suggest, if people who may be watching this are interested in learning about homeopathy, to read a book by Dr. Wendy Jensen called The Practical Handbook of Veterinary Homeopathy. It's a small book, may take a couple of hours to read, and it'll allow for a basic foundational understanding of this modality to be able to begin to see how it might apply in your particular circumstance. Now, in addition to homeopathy, there are other modalities such as herbs, essential oils, ozone treatment, which has a lot of applications as well that I utilize in my practice. Ozone therapy is used in human medicine as well, and there are many different applications for it. It can help with treating infections. It can help with wound healing. It can even be a good adjunct for treating patients who are suffering from cancer, human and non-human animals. And there are a variety of ways that it can be administered. So ozone, just as an overview, it basically is O3. So that's an oxygen molecule with an extra oxygen atom that is an unstable molecule. And it's mostly the oxygen that's administered, but there is a small percentage, about 3% or so, of ozone or O3 that is included when it's administered, often through rectal administration for small animals. It can also be given as an intravenous injection if it's combined with the patient's blood, which is something called major autohemotherapy. There's also minor autohemotherapy, in which a small sample of blood is collected. It's mixed with the patient's vital fluids and some ozone that's then administered as an intramuscular injection. There is subcutaneous ozonated fluids that can be given under the skin of a patient. So then there's also gas, ozonated fluids for flushing wounds, ozone gas to give on wounds to help them heal in lieu of antibiotics. We've learned that antibiotics, while they may have a place in certain circumstances, they can also have negative long-term consequences for overall health, including reduction in the natural flora of the patient. So that means that that can lead to antibiotic resistance and depress their immune system over time. So instead of using antibiotics, one can use ozone for treating wounds, for flushing the dental cavity when dental cleanings are done. Also bagging limbs that are compromised, say like a dog fight wound or something like that. One can actually infuse ozone gas into a bag that's surrounding this injured limb to assist in the healing process. So that's just an overview, but there's a lot more that can be said about it. There are courses that can be taken. There are a lot of books out there about it as well. It's, again, not as well known in the United States, unfortunately, again, because of the squashing by the pharmaceutical industry. But it's important to understand that we have a lot of options available if we just seek them out. And they may not be advertised, they may not be pushed as heavily as we hear about the other options, but they are out there. What was the other question that you had about vegan versus?
Yes.
Right. Okay. So most of the homeopathic remedies are vegan because they're derived from plants. Most of them, they're just a small number of them that are derived from animal sources. And there are thousands of remedies out there. So basically it's like a sugar dilution that's done with this particular substance that's diluted down until there's no actual physical substance remaining, but it's through a process called dilution and succussion, where the substance is progressively diluted more and more until there's just the energetics of it remaining. And that goes into how potent it may be for a particular patient, depending on the patient's vital force, whether it's appropriate to give something that is stronger or less potent based upon what that patient can handle. And that is explained more in that book that I mentioned by Dr. Wendy Jensen, the Practical Handbook of Veterinary Homeopathy. So yes, there are vegan options available. There are also, the majority of the Chinese herbs are plant-based. There are also some Western herbs that can be used for different things. So there's a plethora of options. If people are trying to find a holistic vet, depending on where you live, you can look at ahvma.org. That's the American Holistic Veterinary Medical Association website, and search based on your location for a holistic vet. May or may not be a vegan vet, but you can educate them about veganism. So they can educate you about holistics and vice versa. So it's a good thing to continue to spread our vegan message while learning about other options that we may not have known about.
Thank you.